Good afternoon, everyone. Thanks so much for joining us today for our webinar, the seventh in the series on patient satisfaction and engagement using the Brightsquid secure mail service. Normally, my colleague and friend Jeff McKay would be here with me, but he is unavailable due to the summer months, so I'm going to be the only voice you'll be hearing today. So for the next 25 minutes or so, we're going to be talking specifically about the patient engagement and satisfaction functionality of the secure mail service. I will do a short demo of a couple of features and functions in just a few minutes. But to begin with, well, actually, here's the agenda. Now, we'll be talking about some of the research that we've done about what patients really expect and what satisfies them, what makes them happy when it comes to communicating with their clinics. We have some research results on the patient perspective, how that leads to a stronger relationship, and that, of course, is the all-important stick-to-itiveness of patients remaining with their clinic. Patients as partners in care and patient engagement. Now, it's interesting, as we were preparing this presentation this week, we talk about all the different feelings and behaviors of patients when they interact with their medical clinics or dental clinics, as it were. Now, I often think of this in terms of if we just swapped out the word patient and stuck in customer, we might think a little bit differently about how we serve our patients because they really are customers. So let's take a look at a couple of quotes, and I'll come back to the customer versus patient thing in just a few minutes. So a couple of quotes from the research that I'll let you know that Jeff pulled out of the research and shared with us here for this presentation. But by designing services around patients' needs, it's possible to run a more efficient clinic and achieve higher levels of patient satisfaction. Now, I'm not going to read every word on the screen to you today, but I think this one's really important, is quite often systems and methods are implemented in an organization, whether it's a medical clinic or a restaurant. Quite often, those systems come into place by happenstance rather than by design. And by actually designing your systems and being thoughtful about how you put those things into place, we will often wind up with a much better, more efficient service. And as obvious as that sounds, I know even in my own personal life, if I just let things happen, they're not as efficient as if I plan for what I'm going to do for lawn care or something like that in my own personal life. Next quote, this one I have to explain a little bit. I will read a little bit of this one. The need for interventions exists regarding accessibility. Now, normally when we think about accessibility, we're talking about physical accessibility. What we're talking about here is accessibility to information and data. And the world has changed so much in the last 2.5 years for reasons that I won't name about how people are interacting with their information in the digital world. And so this ability for patients to access their information has become so much more important over the last 2 years. It feels like we've jumped ahead in time as much as 10 to 15 years in terms of what patients, customers are expecting in terms of access to services, access to information, and wanting to interact more directly with their healthcare providers. More specifically, with improved patient satisfaction, with increased access to information and care, we can see strong correlations to improvements in clinical outcomes, the all-important patient retention, the stick-to-itiveness, as I called it a few minutes ago, speed and access to care, and the last two, treatment adherence. By having patients be more informed, they're more likely to follow the instructions of their physicians. In my day-to-day life, I talk to healthcare providers just about every single day, and one of the most interesting pieces of feedback that I get is patients would be so much more healthy if they would just do what I tell them to. I'm paraphrasing, of course, those are not the exact words from a healthcare provider, but that adherence to following the instructions, following up, again, being active in your own care and making a plan and a design, even from the patient's point of view, has tremendous impacts, I think you'd all agree, on patient healthcare. And the last one, it's last because it's most important in my opinion, is an improvement to staff morale and productivity. Um, Communicating more directly with patients, and we'll talk about this in the next couple of slides, or I'll talk about this in the next couple of slides. Communicating in new digital ways is far more efficient and therefore less frustrating than old-fashioned ways of communicating, which we'll come to in a few minutes. So we've all seen these kinds of major bullet points, the information in these bullet points in the past, where one satisfied patient will tell 4 of their friends, but one dissatisfied patient will tell 10. This information dates back to the 1970s. I can remember learning this in college. Not that I went to college in the 70s, but this information is pretty well established and pretty well understood in the industry. And one patient lost to dissatisfaction can cost hundreds of thousands of dollars, because not only do you lose that patient, but potentially 10 more. And those 10 or 11 patients spread the word and don't feed into your practice. And over time, that can be a very substantial impact on the practice's profitability. So, what specific tools in Brightsquid's arsenal of tools can be helpful and can really contribute to the patient satisfaction? So, I will go through these bullet points in relatively a fine detail. So, the first one: incomplete, improper, or poor communication leads to dissatisfaction. Patients will often not complain that they're not sorry, how do I phrase this differently? No patient will complain about getting too much information from their healthcare provider. The most common complaint is, I'm not getting enough information from my healthcare provider. And that's because the phone is a very awkward way to communicate in 2022. I have a cell phone in my pocket just about 24 hours a day, or at least within reach, but I tend not to answer my phone very often. I'm busy at work, I'm driving, I'm at my son's hockey practice. I don't often answer my phone unless I'm expecting a call or it's my wife calling. So when my healthcare clinic does try to call me, it's unlikely that they'll get through. And for various privacy regulations, my doctor can't leave certain messages of a sensitive nature on my voicemail. So instead, what happens is I have a frustrating experience as a patient when my doctors only use the phone as the primary means of communication. Now, when it comes to mail, old-fashioned postage, lick a stamp mail, I mean, it goes without saying, it's slow and expensive and tends to get ignored more often than you might think. And then the last method of communication, unfortunately, is we don't send information to our patients. We expect our patients to call us or come in for an appointment. And if they don't like that, I'm sure they'll let us know and they won't just complain to their friends. It's incredible how much the inertia to not make changes can slow down a practice's growth by not embracing new technology, which, as I mentioned, has really been embraced by the general community, that is to say, patients and customers, over the last 2 to 3 years. So, meeting expectations for our patients and customers. By setting the expectation and explaining to them at the outset, here's how our clinic operates, here's how we'll communicate with you, here's how you should best communicate with us, we're going to better meet those expectations down the road when everyone understands what to expect. Now, of course, if you've ever spoken to me on the phone, which most of you may probably have, I talk a lot about using secure mail as the best way to communicate. And I believe that, or else I wouldn't be making this presentation today. However, I also will acknowledge that not every patient is a great candidate for Brightsquid Secure Mail. We do have a technical support team here that takes calls from patients 8 to 5, Monday to Friday, to help them with technical issues that they may encounter. But it is not out of the ordinary to have patients for whom communicating via secure mail is not the best course of action. And for those people, maybe the phone is better. I'm not saying that when you start using Brightsquid tools, you can throw your phone out the window. I may say that about your fax machine. But phones, certainly not. In-person visits, absolutely the best way to go, especially for, well, for obvious reasons. But some people are not going to be totally on board with using secure mail. We find that our acceptance rate for invitations that go out to patients are not 100%. It's approximately 80 to 85% of patients who are invited to secure mail complete the registration. So those other 20 to 15% are still going to have expectations for a different method of communication. And some of those old fashioned methods that I poo pooed on the earlier slide, or earlier on this slide, I suppose, still have their place. But if we can move as much information as possible over to that digital realm via secure mail, that's going to make everyone a lot happier. And more on that in a few minutes. Now, the last 2 points, well, the next one, the high patient satisfaction associated with effective and positive clinical environments. This was discussed in depth in user groups 5 and 6, so last month and the month before. What we're talking about here is that by enabling staff in an organization to communicate digitally as opposed to those other systems that I've been already railing against, it makes everyone's life a lot easier. Um, so if staff are happier, it stands to reason that patients will be happier when they visit the office where those staff work. And of course, professional satisfaction is increased even more when your patients are healthier. And that was sort of the whole thrust of user group number 6, which was about a month ago. Now, here are some quotes from the patients. Now, I'm not going to read every one of these to you, but I do really like the last one on the page where it talks about secure mail being a very easy to use tool that allows me to access my health information and connect to a health professional with ease and convenience. These are real quotes from patients. And these are the kinds of things that we hear all the time. I mentioned before that our tech support team is here to answer questions for patients that may encounter technical difficulties, and these are the things we hear in response. And it's surprising sometimes, the feedback that we get from all across the demographic spectrum. Not to point fingers in any direction to the front or the back of that spectrum, but we have patients of all ages that use secure mail. And it's not always the ones you would expect who are not interested or not satisfied or not enthused by using secure mail to communicate with their doctors. So using the Brightsquid tools to build stronger relationships, as I mentioned before, our acceptance rate is about 80 to 85% because 90% of users expect to use secure mail messaging, some sort of messaging, to communicate with their healthcare clinics. The other 10% are probably those ones on the demographic scale that prefer phone or in person, and that's fine. We're not throwing phones out the window. 84% of patients are willing to switch healthcare providers based on convenience alone. Now, a lot of that probably has to do with physical proximity. I live in the northwest of Calgary. I'm not going to drive to the southeast to see a dentist, no matter how great he is. I'm going to want to go someone who's closer to me. But if I can maintain virtual closeness through communication tools like Secure Mail, like appointment reminders and bulk messaging and the other tools that Secure Mail offers, that may keep me with someone who is further away if I don't have to physically go there 3 times a year, for example. The next bullet refers to the ability to better set and manage expectations, like I talked about on the previous slide. By having an an explanation and an understanding of the cause of their concerns, they'll again leads to better satisfaction outcomes and adherence to a treatment plan. And wait times, I don't think I need to say too much about wait times, but by reducing wait times with better communication, with better screening, with more proactive care, that too will lead to healthier patients and greater patient, that is to say, customer satisfaction. Patients are no longer just passive in their own care. As I've been saying all along, in the last couple of years, we've seen a tremendous uptick in the amount of involvement that most patients are taking in their own care by logging into online tools to keep track of and manage not just their own care, but also the healthcare situation of their family members. So patients are active in their care, and the secure mail tools allow us to better include them um, in how all that happens. So of course, we can invite patients to secure mail to begin and open up that line of communication. We can provide them homework, and I'm making air quotes, but my camera's off, so just imagine it for a second. That homework is giving the patients or asking the patients to fill in the information that we may need before they even physically arrive in your office or before a virtual care meeting, if that's the kind of thing that you're doing for your patients. So you can send those forms and questionnaires to your patients ahead of time. I find personally that filling in a questionnaire at home, when I have time to think about it, when I have time to consider when's the last time I had a headache, when's the last time this situation happened, if I can fill that in at home and I can discuss it with my family members, I'm going to provide far more detailed information and far more accurate information if I'm put on the spot and asked the same question while I'm sitting in the exam room with my doctor. So it's really helpful to the patient to give them time to consider and answer these questions and then send them back through secure mail. Now, when it comes to the pre-appointment expectations, as most of you probably know, and I will show you this in a moment, we have templates built into the secure mail system to allow you to sort of pre-answer common questions. Where do I park? How do I get to your office? How much does parking cost? What do I need to bring? All those things can be answered with predefined templates that, again, we deliver to them ahead of their appointment before the appointment. Now, when it comes to post appointment, the same tool applies. Follow up questions, follow up queries about how is your wound healing? Have you had any headaches? Those sorts of things. Patients can respond to those remotely without having to physically visit their doctor or call them on the phone. We keep patients informed. One of our newer tools that some of you may have discovered already, but I'm going to show it to you today, is our panel messaging. Long and the short of it, it's like a mail merge that lets you send a bulk message to tens, hundreds, thousands of patients simultaneously, notifying them of things that may be important. And I'll talk about that in a few minutes. And of course, connect the circle of care. Not only can you communicate back and forth with your patients, you can also communicate back and forth with other healthcare providers. And then you can connect everyone together. Just like with regular email, where you can CC multiple individuals on a conversation, so too can you use secure mail. So you can have a conversation with a patient and a specialist, for example, in one secure messaging thread. All right, trying to pick up the pace here a little bit because I do want to get to the demonstration. So I talked a little bit about this on an earlier slide, how secure mail tools and Brightsquid tools make life easier for staff members. By refocusing time and getting off of the phone. Oh my goodness, I talk about this all the time. Trying to call and make phone calls and leave voicemails can be very frustrating. You can spend a lot of time listening to outgoing voicemails only to have to leave a vague or incomplete message for privacy reasons. It's much better to be able to just send a secure message and check tomorrow to see if they've read it. I talked about increasing the effectiveness of visits, reducing the amount of time we spend on the phone, talking about dead end calls. All of this comes at the benefit of staff members who no longer have to make those tedious phone calls. The last one at the bottom, when it comes to traditional old-fashioned lick a stamp mail, stop for a moment and consider how much you spend on mail, how much it actually costs to not only buy a stamp, which is about $1, I think, but the time it takes, or sorry, not just the time, but the materials that go into that, your printer ink, your envelopes, your of course the paper itself. All of that adds up to a pretty significant amount, not to mention the amount of time it takes to physically fold the paper and put it into the envelope. If you can eliminate even a third of your mail, you can likely save your clinic hundreds or even $1,000 a month just on the reduced cost of outgoing mail, even just the physical components of sending those messages. All right, so we're going to transition now out of my slides and over to a live screen broadcast, and I want to show a couple of features that I've been talking about today. The first three you've probably all seen before. Some of you may have used a lot of them in the past, but the newest one, panel or bulk messaging, as we sometimes call it, is an all new system that I'm excited to show everyone today. So let me do this and this. And this is our familiar Brightsquid Secure Mail interface. So everyone who has been using Secure Mail, you're likely all familiar with this, so I'm not going to go over the basics. But when we are communicating out from the clinic to a patient, long and the short of it, you're either going to be sending a message to an existing Brightsquid Secure Mail user, a patient who you've talked to in the past, or you can invite someone new who may have never used Secure Mail before. In either case, when you are sending the message, as with traditional old-fashioned email, when we compose and send a message, we simply address it to our intended recipient by way of their email address or their name. Now, in the case of a professional user, we can also add the clinic to that option. But I'm going to send a message to Oscar, oops, I typed that wrong, oscar@brightsquid.com. Now, when I put that email address into the field, I know that this is a patient of mine. And I know this is his email address because he just left my clinic after his first appointment. But when I type in oscar@brightsquid.com, nothing pops up in my autocomplete and nothing is in the Brightsquid community. So now as a subscriber to Secure Mail, I can invite Oscar to register their own account. Now, I'm not going to go through the whole process because I know most of you have seen this dozens, if not hundreds of times. But for those that haven't, once you invite someone to Secure Mail, you simply designate what their role is within the community, probably patient in most cases, and those patients will now establish their own account on the Brightsquid Secure Mail service. And as I kind of alluded to earlier, once a patient is registered in Secure Mail, they can communicate with all their healthcare providers that are in the Brightsquid system as well. So what I'm driving at is I may be invited to Secure Mail, or Oscar may be invited to Secure Mail by his family doctor, but now he can use that same Secure Mail account, the same login ID and the same password to communicate with his family doctor, his child's pediatrician, his chiropractor, or what have you. It's a community of connected individuals, not a single portal between a patient and one organization. So let's skip out of Oscar here, and I want to go back, and instead I'm going to send a message to Adam. So Adam's already in my list. He's a common communicator of mine, and once I've addressed the message to him, I can send him anything like I would through traditional email. I can, of course, manually type a subject line. I can type the body of my message, and I can attach any files from my computer that I may want to share with him. So from here, I can grab this PDF document and attach it to an outgoing message. But rather than doing this kind of thing manually, I talked about templates a lot in my presentation a few minutes ago. So if I'm sending a message to Adam, rather than typing it from scratch, rather than manually dragging and dropping all of the files, you can see where I just selected the template called New Patient Welcome Message, and my message is now auto-populated. So welcome to Secure Mail blank. We're going to fill in his name there on the version that he sees. And then here's all the message explaining about how Secure Mail works, the kinds of things that we're going to use Secure Mail for. Remember the all-important setting of expectations that I talked about a few minutes ago? All of that can be built right into your own custom welcome message. And additionally, all the attachments that I want Adam to have been now attached over here. So he can now receive this information, he can fill it in, and he can send it back as need be. Now, how does this work? Well, if we go down to settings and we go to the tab titled templates, here is where you can create all the different templates that you may want to use in your clinic. You can literally make as many templates as you need for your organization. When you go here for the first time, you'll see a couple of sample templates that we built to kind of get your creative juices flowing. But most importantly, you can make your own custom templates for any eventuality that may cross your desk. So here's an example where I'm sending patient advice. So as a clinician and I'm sending a message to a patient, I can now respond back to the patient. And this one mentions how it may be a billable event. That's not really that important, but what is important is we're putting all of the relevant information into this template to make sending this message to a patient or to a professional user that much more efficient and quick the next time we go to do it. All right, so the new feature that I was talking about is the concept of panel messaging, or bulk messaging as we sometimes call it. I'm going to switch over to that point of view now. I have to log in, of course. So when I log into my panel messaging system, the idea here is that I can generate a list of patients from my patient database, whether that's an EMR or a practice management service or whatever database that I have, and I can import that list into the panel messaging system. So I'm going to go fairly quick here, but if you want to see this in more detail, please let me know, and I'm happy to do a one-to-one demo for you. So from the patient list section, I've already uploaded the list of patients. Now I've only got 3 patients here in my list. And they're all named Jack. That's a little awkward. All of these patients are now in my list called test. We can see that we've highlighted one of the people who doesn't actually have either an email address or an SMS phone number. So we're going to eliminate him. So now we have a list of 2 people. This list can be literally hundreds or even thousands of patients long. And now I can take everyone in this list and send them what we call a campaign. Now the campaign is going to be a message or a group of messages that these patients will receive, and they'll be notified either through traditional old-fashioned email, like with a regular secure mail message, or we may notify them via an SMS text message if we have that information. This is the first time that Brightsquid has opened up the ability to communicate directly to patients through an SMS text message. It's only available right now here in the panel messaging tool and in our appointment reminders, but that's a conversation for another day. So let me very quickly create a campaign. And because I'm not feeling very creative, I'm just going to call my campaign test. And we're going to send my test campaign to all of the patients in the list called test, of which there's only 2. And the content that I'm going to send them is going to be update on clinic. And from another window that you can't see right now, I'm just going to copy and paste a message about what's happening in my clinic. So in this case, it's just a really quick note that explains that the clinic's going to be closing or one of the doctors is leaving is the actual text of this message. And I can fill that in with placeholders like we saw earlier with the templates. And at the bottom of the message, there's a little footer that's automatically generated based upon your clinic details. And now I can send this message to the 2 people or the 2,000 people that were on my list. Now, the first part of this message is going to be delivered through traditional email or an SMS text message. But as with our secure mail service that you're all familiar with, we can also include secured content. Now, you may be asking yourself, what kind of secure mail message would I want to send to 2,000 patients? Well, let's say we have a list of patients that all have diabetes, and we haven't seen 15 of them in 2 years. Rather than sending them 15 individual messages, you could import that list of patients into the panel messaging system, send them a message, and the secure content would say, "Dear John, since we haven't seen you in 2 years, we're concerned about your diabetes, so we'd really like you to contact us to book an appointment as soon as possible." And you could swap out diabetes for just about anything. Men over 50 should come in for a particular type of exam. Women over this age should come in for this kind of exam. Children who are turning 13 should come in for this kind of exam. All of that information that's in your patient databases can now be mass delivered to call to action certain members of your patient community. Now, I know that a lot of you already have patient recall tools that send out automatic reminders to patients to come in. This is more specific than that because it's secure through the Brightsquid Secure Mail platform. You can say things like, "We need you to book an appointment because of your condition XYZ. please call us immediately to book, or as soon as possible. Let's not make it too urgent. Please book an appointment with us as soon as possible because we haven't seen you in so long. So that's the whole concept behind the panel messaging system. You upload a list of patients from a CSV or an Excel spreadsheet. You compose your message. You merge the two together, is what Microsoft Outlook calls it. It's a mail merge, really, and you can now deliver secure messages with attachments to 10, 100, 1,000 of your patients simultaneously. Really quickly on this, your subscription to Secure Mail entitles you to send as many as 500 messages per month at no additional charge. Any amount over 500 is like $2 or $3 per 500. So it's really not that expensive. Now, I didn't have a lot of questions come in, so I think with that, we will call an end to today's community event. And if there are additional questions after the fact, you can always call us. Our phone number is on the screen there, and you can contact us through our support panel, which is support.brightsquid.com. Thanks so much for taking the time to listen to me today. I hope you're having a great afternoon, and all the best.